106 years ago, Mary Clark Thompson established Thompson Hospital to demonstrate to the community how much she and Fred were committed to ensuring that all members of Canandaigua and the surrounding towns and villages be healthy and treated when and as soon as they needed. In their own way, the Thompsons' generosity and concern was the healthcare reform of its day. Their individual power brought about many, many years of excellent and compassionate care for all entering the doors of the hospital. Today, we continue that legacy of caring, having passed that responsibility down through the generations. Community leaders continue to oversee a health system that serves people beyond the boundaries of Ontario County and ensure that confidence and compassion is brought to every healthcare experience. Associates, medical staff, and volunteers together every day are committed to bringing only the best in care and service. This is the power within the walls of Thompson facilities. This is the power that creates the positive healing environment so that strength and energy is rejuvenated in each individual so that they can feel their own power again. This video speaks 1,000 words about how Thompson in 2009 continues to strengthen its commitment to the legacy of caring. What better place to start than the Thompson Clinic? We came full circle with our legacy of caring in 2009 through our partnership with the Canandaigua Churches in Action and the Catholic Charities of the Finger Lakes to create this new clinic. In doing so, we came back home to 120 North Main Street in Canandaigua, the site of the original hospital that Mary Clark Thompson founded in memory of her husband, Frederick. Staffed by a nurse practitioner and a medical assistant, the clinic is set up with a sliding fee scale in order to help people in our community who are uninsured and underinsured get the health services they need.
It's a great feeling knowing that we're caring for patients who haven't seen a doctor in years because they haven't had health insurance and who have gone many more years without seeing a doctor if not for this clinic.
Within 3 years, the Thompson Clinic is expected to serve more than 3,000 people annually. I think that would make Mary and Fred very happy. If only statues could smile. Just as the Thompson Clinic was established to meet a specific need, the Thompson Health Medical Center in Farmington is responding to the needs of others in our region. These are people who happen to get those little curveballs like minor injuries or illnesses at inconvenient times. Following an extensive renovation and expansion of hours, the urgent care is meeting the demand. During the latter part of 2009, as the H1N1 virus peaked, urgent care saw more than a 300% increase in the number of patients needing timely, convenient, and cost-effective treatment.
So many of our patients have told us they're very glad we're here. We're right off 332, near the thruway, have opened weekends and extended evening hours, and with the addition of our new digital x-ray capabilities, we have so much to offer them.
Over the summer, we marked the completion of a long overdue makeover to the entire third floor of our nearly 40-year-old hospital. In addition to ADA compliant nurses stations, we now have new paint and wall covering, new curtains and flooring that was designed with our associates' ergonomic health in mind.
These may seem like small changes to you, but for those of us that work here at Thompson, it makes a really big difference. And for our patients, it creates a much more healing, relaxing atmosphere.
It's comforting to know that at the Sands Cancer Center at Thompson Health, our community has vital access not only to a top-notch treatment team, but to the advanced technology they need. The newest addition is the state-of-the-art linear accelerator, which sharpens the delivery of radiation, sparing healthy tissue, and also reducing treatment times.
We're very happy to be able to offer our patients this cutting-edge technology. Not only will it give our patients peace of mind, but it will also enable us to deliver precise radiation treatments, minimize side effects, and enhance patient safety.
You may recall that in 2008, one of the highlights at Thompson Hospital was the installation of a new MRI machine. Well, in 2009, this impressive piece of equipment became fully operational, which expanded the services our diagnostic imaging department is able to offer patients. Most recently, we announced that we are now able to offer breast MRI. Used in combination with mammography and ultrasound, breast MRI is a highly sensitive yet non-invasive way in which to screen patients who are at high risk for breast cancer, determine the extent of breast cancer, or monitor the response to therapy. In addition, our new MRI machine gives our technicians the capability to perform MRI-guided biopsies, which are especially helpful when there is an area of abnormal tissue changes not identified by other imaging techniques. If you've ever been too hot or too cold at home or at work, you can appreciate the completion of our train project at the Ewing Continuing Care Center. This highly efficient system not only reduces energy use and gives us the ability to quickly address any problem, but it gives staff and residents alike the ability to control the thermostat in each room, bringing individualized, custom comfort.
We have over 1,000 thermostats all around the building connected to this computer. This helps to ensure that everybody's not too hot, not too cold, that they're all just right.
Now that the residents are able to adjust their own temperature in their rooms, it feels just like home.
As you browse our annual report, you will see that our 2009 accomplishments were not limited to changing and upgrading our facilities. Through our senior community, continuing care center, hospital, foundation, and properties corporations, we continue to develop programs and services that enhance the quality of life for our communities. I cannot close 2009 accomplishments without mentioning Ontario County Advanced Life Support. After 15 years of advanced paramedic services throughout the region, we successfully transitioned the corporation to the Canandaigua Emergency Squad. In doing so, we continue to support pre-hospital providers and appropriate levels of care. If you had the opportunity to enter one of our many doors, you most definitely experienced the power within. The smiles, the gentle touches, professional talent, skilled hands, and caring hearts. It certainly was a very successful year for Thompson, and so many who graced our halls. Already, 2010 is shaping up to be another exciting year, and as always, we will continue to expand access to only the best in quality health care and services, to extend our outreach and to be even more responsive to the changing needs for service and the changing healthcare marketplace, creating places that inspire the healing power within.